Member for Redlands.
Thank you, Acting Speaker. I rise in strong support of the health legislation. Good start. I rise in strong support of the Health Legislation Amendment Bill 2025, legislation that delivers on the LNP Crucifoli's government commitment to restore trust, strengthen performance and bring real change to Queensland's health system. As the member for Redlands, I know how vital a strong and responsive health system is to our community. One of our largest local employers in the health sector is the health sector, filled with dedicated nurses and doctors, allied health workers, support staff who cares for us at our most vulnerable. These are the people delivering babies, treating emergencies, supporting mental health, and walking families through chronic illness and rehabilitation. They don't just know the system, they live it every single day. In fact, I'm proud to say my own auntie worked as a nurse at the Redlands Hospital for more than 25 years. I watched her navigate shift work, change and constant pressure, always putting patients first. That personal connection shapes my deep respect for those who work on the front line. This bill recognises that value by giving those workers a seat at the table. Under the amendments to the Hospital and Health Boards Act, every hospital and health board in Queensland will include at least one frontline clinician, someone actively working in direct patient care. These aren't token appointments. Clinicians must have at least 2 years' experience and continue working a minimum of 8 hours a week in public health settings. They will bring real insight into how policy impacts practice, ensuring boards are guided not just by KPIs or reports, but by practical, patient-centred knowledge. In Redlands, I've heard directly from our hardworking health professionals about issues they face: workforce shortages, rising demand, and the need for better local decision-making. They don't just want bureaucratic solutions imposed on them from above. They want smart, workable change that reflects their realities. This bill delivers that. The reform takes effect from April 2026, giving time to recruit the right people, those who will bring genuine frontline experience into Queensland health governance. Some may raise questions about conflicts of interest, but let's be clear. Even under the former Labor government, appointed board members currently serving as practicing clinicians. The Integrity Commissioner has confirmed that existing safeguards are sufficient, and under the bill, clinicians will be excluded from serving as chair or deputy chair to further protect good governance. Speaker, the Crucifoli government isn't just promising change, we're delivering it. And this bill goes beyond governance. It also tackles one of the fastest growing public health threats, illegal vapes and illicit tobacco. Under the former Labor government, enforcement was weak. Vape stores operated openly and vaping among Queensland students tripled between 2017 and 2023. That's not just a concern, it's a crisis. This bill strengthens enforcement under the Tobacco and Other Smoking Products Act. It allows the immediate forfeiture of seized goods, cutting down storage risks and delays. It also introduces court-ordered cost recovery, meaning offenders will foot the bill for the seizures, investigations and prosecutions. The results are already clear. Just 1 week after we introduced the nation's toughest fines, $5 million in penalties were issued, over 20 times more than the weekly average under Labor. And in March, Operation Appaloosa saw Queensland Health lead Australia's largest seizure of illicit tobacco. 76,000 vapes, 19 million cigarettes and 3.6 tonnes of tobacco off the streets and out of the hands of our children. And as a parent, I take great comfort in knowing this. Speaker, this bill reflects the values of Redlanders. We care for one another. We believe in empowering those who serve on the front line, and we won't stand by while public health is undermined. To our local nurses and doctors and healthcare workers, this bill backs you. The LNP Crucifoli government backs you. and I will keep fighting to ensure your voice is heard and respected, because you're essential to building a healthier Redlands and Queensland.
Speaker.